So dear friends, today we are going to start this class on pulse diagnosis. That we know in the pulse diagnosis, what we do, we just feel the pulse and try to predict that what's happening inside the body. Am I audible clearly? Audible? Okay. So we are trying to find out what's going on inside the body. So pulse is like a music, like someone playing the music, and we can find out, okay, this music is going on. Okay, maybe from this movie. Oh, I have heard this music earlier. So we can correlate. Okay, this music from that movie. In the same way, when we do the pulse diagnosis, okay, pulse is like this. It means this pulse want to tell something like this. But suppose today you start, you want to learn the guitar. Okay, you cannot learn guitar in one day. Can you learn the guitar in one day? No. You have to learn basic techniques of the guitar. You have to practice. Then in a month, you will start playing something which is looking something better, something good. In the same way, when we are discussing pulse diagnosis, so first we have to learn everything about the pulse. That what is the meaning of this pulse? What is the meaning of that pulse? But every day, whenever anyone, whether a family member or your friend or your patient, you have to keep checking the pulse again and again. And you correlate, okay, the meaning of this pulse is like this. Then you ask the person, do you have this problem? And correlate, then we can understand the pulse reading. Okay. It will take time. Minimum, it will take 21 days or so to have the better sense, better feeling. Initially, many person, if suppose if someone is very new, even will not able to find the pulse. Where is the pulse? And then doing the prediction out of the pulse, it will take some time. So whether anyone can learn the pulse? Answer, only the mind who is relaxed, only the mind having parasympathetic mode can learn the pulse. If you are in the hurry, if you are in the curry and the lots of bhagam bhag, then it's very difficult to learn the pulse. Once you learn, then there is no issue. Even then, while the running, you can predict the pulse. But initially, you need to calm down yourself. You need to settle down yourself, and you have to learn the music of pulse. So for this purpose, we have to develop our awareness. We have to develop our intuition little bit. I will tell you, as per the Ayurveda, there are 72,000 nadis. Nadis are going from here to there, from top to bottom, from bottom to top. There are too many nadis, too many nerves. Okay. They are very, very subtle. So when we are checking the pulse, exactly we are trying to feel the nerves, but it's very difficult to feel the nerves if that subtle nerves. So what we do? We will start with the arteries, like we know radial pulse. In the radial pulse, what we do? In the radial pulse, we start seeing the throbbing of radial artery, because radial artery passing from here. Okay. So we will start feeling the throbbing of a radial pulse. Then we will try to predict, okay, this means this person is having some cardiac problem or the heart problem, this means this person is having digestive disorders or the thyroid problems. In this way, we will try to understand the variation and the differentiation. Okay. So when we start the pulse, so would like to bring your focus here. During this pulse diagnosis workshop, what we are going to learn, so this is the ancient wisdom, and not only we, the many Ayurveda practitioners, many Chinese practitioners always used to do the pulse diagnosis before making any prescriptions. Okay. So there are two levels. In the level number 1, what we do, we will work to develop that how to develop the intuition, how to become a very good observer, how to feel the pulse, and definitely we will be learning various types of the pulse in the level 1. So in the level 1, we are going to learn this various type of pulse. They are called like the Chun, Guan, Qi, and the various type of the pulse like the pulse of heart, liver, kidney, and we know the 12 meridians. So we will be learning the pulse of all the 12 meridian in the level 1. Okay. So in the level 1, number 1, we have to become a very good observer. We have to develop our intuition, and we have to learn the pulse of all 12 meridian. Then in the level 2, we will go in the deeper detail, and in the level 2, we will be learning these various type of the pulse. We can see these all are different type of pulse. The every pulse is telling something different. Okay, so we will be proceeding step by step. So in this sequence, first step, I will introduce the 9 reason of pulse diagnostic area. In the human bodies, we can divide the entire body in 3 parts. So we can see this is the head region. So these are the arms, arm, and here we are having these are the legs. So 3 pulse we will check on the head region, 3 area where we have pulse will check in the arm, and the 3 area we will be checking in the legs. So initially we are going to check 9 region, 9 areas where we are palpating or where we are feeling the pulse. ओके, तो हमारे सिर में 3 जगह हैं जहां पर पल्स को फील करना सीखेंगे। हमारे हाथों में भी 3 जगह हैं, हमारे पैरों में भी 3 जगह हैं। तो इस तरह से 9 जगह को हम पल्स के माध्यम से फील करने की कोशिश करेंगे। Once we learn the pulse diagnosis, we want to find out, okay, what is the energy of the head region? Whether we should consider is a deficient energy by the person having headache, whether low BP or the high BP, whether the low condition or the hyper condition. So there are 3 areas of the pulse we will check in the head region. In the same way, 3 area in the arm and 3 area in the leg. So initially, I will just tell you to palpate 9 pulse, and all the 9 pulse are explaining the different conditions. Okay, so I want to know you because how many person not comfortable in English? कितने लोग इंग्लिश में कंफर्टेबल नहीं हैं? कितने लोग इंग्लिश में कंफर्टेबल? सो नो प्रॉब्लम, आई विल स्पीक इन बोथ लैंग्वेज. तो अभी तक हमने बताया कि हमारे शरीर में ऐसे 9 स्थान होते हैं, 3 सिर में, 3 हाथों में, 3 पैरों में, जहां पर हम पल्स को चेक करेंगे. ठीक है. और प्रत्येक स्थान कुछ स्पेशल कंडीशंस के बारे में बताएगा. ओके, लेट्स प्रोसीड नाउ. सो आई विल स्पीक 70-80% इंग्लिश, 20% हिंदी. ओके, फाइन. So let's see here. First, I will tell you the entire chart. So look at here. So we can see here the 3 area of the pulse in the head region, 1, 2 and 3. सिर में 3 जगह हैं जहां पर हम पल्स चेक करेंगे. 3 area of the pulse in the hand, 1, 2 and 3. हमारे हाथों के 3 स्थान हैं जहां पर हम पल्स चेक करेंगे. The 3 area of the legs where we have pulse, जहां पर हम पल्स चेक करेंगे. Okay. If we talk about only the head, let's talk about the head. So the pulse of head we have divided in 3 parts: upper pulse, middle pulse, lower pulse. हमने हाथों की पल्स को 3 भागों में डिवाइड कर दिया है, अपर, मिडिल एंड लोअर. हमारे सिर की पल्स को. तो व्हाट आई वांट टू टेल यू, हमारे जो सिर में 3 पल्स हैं उनको हमने 3 पार्ट में डिवाइड किया, अपर, मिडिल, लोअर. There are 3 pulse in the hands, upper, middle, lower. There are 3 pulse in the legs, upper, middle, lower. Okay. So in this way, 3 plus 3 plus 3, how many total pulse? कितनी पल्स हो गई टोटल? 9 पल्स. ये कौन सी पल्स डायग्नोसिस? ऐसा तो कभी सुना नहीं है. पल्स डायग्नोसिस तो यही करते हैं. ऐसा दिमाग में कोई क्वेश्चन आता है क्या? अगर आता है तो मैं आपको बताऊं, पुराने जमाने में जो हमने भी देखा, हम जब छोटे थे तो वैद्य जी जब यहाँ पर चेक करते थे पल्स, ही इज हैविंग सम प्रॉब्लम इन द हेड रीजन, he used to check the pulse in the different body areas. Pulse even in the Chinese acupuncture. जब आप चाइनीज एक्यूपंक्चर में देखते हैं, देयर आर मेनी चाइनीज एक्यूपंक्चरिस्ट, दे आर चेकिंग द पल्स लाइक दिस. You will see what they doing. Pulse would be checked like this. He's taking pulse like this. Even they are not using the fingers, they are using thumb. Okay. Yes, yes. Okay. Sometimes we are checking the pulse here. Okay. So many Chinese practitioners check the pulse here. They are checking the pulse of the, if the person is suffering with a cardiac problem, we will see the throbbing pulse here. Throbbing pulse in this area. So definitely this is the radial arteries, but here also we have ulnar artery. Okay. So in this way, let's start step by step and start from the head region. हम पहले सिर से स्टार्ट करते हैं. So in the head region, there are 3 places. Number 1, Taiyang. Taiyang is telling the condition of head. What is the chi of head? Number 2, stomach 3. What is the condition of mouth? What is the chi of mouth? And number 3, triple warmer 21. The condition of ear and eyes. Okay, let's try to understand these 3 pulse first. So definitely after this, first we will be working, we will be activating our parasympathetic nervous system. So there is a technique, I will tell you how to do that. Okay. So the condition number one, we want to find out the chi of the head region. What is the condition of the chi in the head region? Whether the excessive chi flowing in the head or the deficient chi flowing in the head. कि सिर में ऊर्जा की अधिकता है और ऊर्जा की कमी है. Okay, how to check this pulse? So the point is Tai Yang. Okay, so we can see here from the corner of eyes, if we are going one chin apart, that is the location of Tai Yang. We can feel the pulse here. This Tai Yang is the very good point. This is called Supreme Yang. The name of this point is Supreme Yang. We know this point is available in the temple. हमारे temple में point पाया जाता है, and it's a one chin apart from the eyes. हमारी आंखों से एक चुन की दूरी पर है, and we are also using this point for headache. Okay, this point is one of the great points. Okay, so why this point is so useful? I will tell you. If anyone is suffering with a headache, anyone is having headache, you tell the person lie down. Okay, the person is lying down. Then what do you have to do? You have to keep your finger or thumb here. From the corner of eye, you have to go one chin lateral. We will feel the depression here. This is also called apang marma. Those who learn marma, they know this is apang marma. In the acupuncture, this is the point called Tai Yang. You have to keep your one finger or two finger, or you can keep your thumb. The condition, please remember, never do the vigorous acupressure here, because very special bone is here. The name of that bone is sphenoid bone. सुना है आपने स्फीनोइड बोन के बारे में? किसी ने स्फीनोइड बोन सुना है? स्फीनोइड बोन इज द किंग बोन ऑफ दिस फ्रंट कंपार्टमेंट. हमारे सिर में बहुत सारी हड्डियां होती हैं, उसमें एक स्फीनोइड बोन होती है. So when we are keeping the finger here or the two finger here on the both side, just very gentle touch without doing any pressure, just feel the pulse. You have to feel the pulse for 20 seconds, 30 seconds and 1 minute maximum. If you are keeping your finger more than 1 minute, then treatment will start. अगर आपने 1 मिनट से ज्यादा यहाँ हाथ रखा, तो अब वो टेस्टिंग नहीं रहेगी, वो क्या हो जाएगा? ट्रीटमेंट. ट्रीटमेंट मतलब if the person is suffering with a headache and you are keeping the hand more than 1 minute, then you will see results in the headache. Person will tell you, I'm feeling light, my headache is reduced, I'm feeling much better. Okay, so let's say here, keeping my two finger here on both the side, and just try to feel some pulsation, some vibration, because this is the point explaining the chi of head region. Relax. Okay, now do one thing. We will activate the little bit chi here. अब हम यहाँ पर थोड़ी chi को activate करेंगे. We will do two things. अब हम दो चीजें करेंगे, और दो चीजें करने के बाद हम वापस इसी पॉइंट को चेक करेंगे. फिर हम देखेंगे क्या चेंजेस हुआ और रियल चेंजेस. So let's see here. We are going to do two things. The things number one, we will do neck roll, and the condition number two, we will do Brahmari or the humming bee breath. Okay. So neck roll for 2 minutes and Brahmari for 2 minutes. And after that, again, we are going to check the same point, that is Tai Yang or the Supreme Yang. Okay, let's start. Remember one thing, we will not do rotation. We will not do rotation, because if the person is having cervical spondylosis, might be condition become worst with the rotation. So rotation is not recommended for any patient who is having cervical spondylosis or neck pain. You don't know why the neck pain. We can do front and back movement, and we can do side movement, and we can do this movement. But don't do this movement because I don't know if some of you having neck pain. Okay. So let's start. Very gently, very just inhale and take your head to the back side. सांस लेते हुए अपने सिर को पीछे ले जाना है. Do very gently. Then breathe out and come back very gently. You can do as per your own, but very slowly, very gently, without any jerk. We are not doing any physical exercise. If you are doing very fast, it means you are in the sympathetic mode. Do 5 times. Do not forget to breathe in while taking the head back, breathe out while bringing the head down. Keep doing till you complete the 5 rounds. If the person is suffering with a headache, the same point means Taiyang you can hold for 3 to 5 minutes. Body is having its own intelligence. Just you hold the point and you will see the effect in the headache. Don't think, oh, I have to do acupressure, then only this person will be okay. ऐसा मत सोचिए कि आप एक्यूप्रेशर करेंगे तो ही ठीक होगा ये. बॉडी के पास अपनी खुद की इंटेलिजेंस है. आपने जैसे ही पॉइंट को टच किया वो हील करना चालू कर देगी. Okay, now side by side. Start doing 5 times on the side. So one here, that is 1 round. So we have to do 5 rounds. So with the help of this, we will be activating our vagus nerve, our parasympathetic nervous system, and we are activating energy in the head region. Today is the day one. I'm not focusing much on the breathing, but breathing is very much important with the movement. Okay, those who have done the 5 rounds, they can stop. Now we are doing half rotation. And you also can check whether your neck is going at least 70-80 degrees. If your neck is not going, means your neck is having stiffness. Okay, after completing these 5 rounds, so now we'll be doing Brahmari 5 times. Then we'll check again our Taiyang. Brahmari we know. So while doing the Brahmari, we have to do in a different way. We have to inhale and we have to fold our tongue. But we know in the normal yogic practice, we are touching the tongue with the upper palate. But here we have to do it in a different way. What is different way? We have to fold the tongue, but we don't have to touch anywhere. We don't touch. Okay. So we have to hold it tongue like this, but don't touch. And do the Brahmari. Inhale. Inhale again. Inhale again. Inhale. Inhale. Gently open your eyes. जब मैंने पल्स डायग्नोसिस सीखी थी पहली बार, तो हमें पहले तो 3 दिन एडवांस कोर्स करवाया था। कुछ नहीं सिखाया, सिर्फ एडवांस कोर्स, सुबह से शाम तक बस मेडिटेशन, ध्यान, अपनी ब्रीदिंग पे फोकस करना, जस्ट फोकस ऑन द ब्रेथ। उसके बाद हमें बॉडी ट्रेवल करवाया था, बस फोकस ऑन योर टूज, फोकस ऑन योर नी, जैसे शवासन में कराते हैं ना, फोकस ऑन योर लोअर बैक, मिडिल बैक, अपर बैक। पूरे 2 दिन हमें बस बॉडी ट्रेवल ही कराते रहे, बार 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 बार। उसके बाद हमें ये सब चीजें सिखाई गई थी जो मैं अभी आपको बता रहा हूँ। ओके, पर मुझे पता है कि मैं अभी 3-4 दिन सिर्फ आपको ये सब कराता रहूंगा तो आप लोग बोर हो जाएंगे, है ना, बोलोगे क्या करा रहे हैं, हम पल सीखने आए हैं, कोई ब्राह्मरी थोड़ी करने आए हैं। इसलिए थोड़ा इधर थोड़ा इधर थोड़ा इधर मिक्स करके मैं आपको बता रहा हूँ। ओके, तो वो भी मिल जाए और ये भी मिल जाए, फाइन। ओके, नाउ check the pulse again here. Again, keep the finger on the thigh and check what changes happen. So right now, whether you are able to feel it or not, there is no issue. But after a few days, definitely you will tell, oh, my pulse become little relaxed. Pulse become little, pulse is little calming down. Okay, you will definitely feel this. Pulse will be getting little slower. Yes, calming down, relaxed. Then we will be feeling the, okay, how the throbbing is happening. वो पल्स जो थ्रॉबिंग कर रही है वो कैसी है, उसका नेचर कैसा है, दैट इज द नेक्स्ट स्टेप, फाइन। सो दिस वाज द पल्स ऑफ लंग, दिस वाज द पल्स ऑफ ताइया। अब किसी पेशेंट को हेडेक है, आप उसे लिटा दो पेशेंट को, और अपनी दोनों उंगलियां इस पर रखकर बस बैठ जाओ, डोंट डू एनीथिंग, जस्ट कीप द फिंगर हियर ऑन द thigh arm, minimum 3 minutes. And if you can go maximum, you can go 5 minutes, 8 minutes, 10 minutes. Condition, very important condition. If you press even something, you will damage something. Don't press, just touch. आप ऐसा समझिए मत कि आप बॉडी को ट्रीट कर, आप समझिए आप सिर्फ एक एनर्जी को ट्रीट कर रहे हैं, बिकॉज दिस प्लेस इज वेरी मच इंपॉर्टेंट। आई विल टेल यू व्हाट एग्जैक्टली वी आर टचिंग हियर। यहां पर हम टच क्या कर रहे हैं वो आप समझ लीजिए। लेट्स सी हियर, सो वी कैन सी, सो वी कैन फाइंड द डिप्रेशन हियर। यहां पर हमें डिप्रेशन दिख रहा है, दिस द डिप्रेशन व्हाट वी आर टॉकिंग अबाउट, ताइयांग। or the supreme yang. Okay. In this depression, there is a bone. ये bone है. We are working on this bone. The name of this bone is sphenoid. That is called the king bone of front part of the head. Front part of head. हमारे फ्रंट पार्ट ऑफ द हेड की एक किंग बोन है. अब देखिए बोन कितनी बड़ी है. आई विल शो यू द लेंथ ऑफ दिस बोन. इफ वी रिमूव ऑल द अदर बोन, अगर हम सारी दूसरी बोन्स को रिमूव कर दें, लेट्स सी हियर. इफ वी रिमूव दिस ऑल बोन फ्रॉम द सराउंडिंग, ये सारी बोन को अगर हम हटा दें, ये देखिए हटा दीजिए. नाउ यू कैन सी ये बोन कितनी लंबी है. फ्रॉम राइट टू लेफ्ट दिस एंटायर बोन इज वन. दैट इज कॉल्ड स्फिनॉइड बोन. ये जो पूरी की पूरी बोन है, एक ही बोन है. ये एक बोन है. जनरली आप देखोगे ना तो फेस में भी एक बोन इधर है, दूसरी बोन इधर है ना. एक टेम्पोरल इधर, दूसरी टेम्पोरल इधर, एक पैराटल इधर, एक पैराटल. बट दिस बोन फ्रॉम हियर टू हियर ओनली सिंगल बोन. दैट इज कॉल्ड sphenoid. Got it? So very important bone. When we are doing this pulse diagnosis, we are checking what is the condition of sphenoid. Any disharmony happening in the head region, the first bone get disturbed, that is sphenoid. Okay. So now let's proceed for the point number 2. That is the, as per this chart. So in the head region, now we are going to the second or the middle pulse. हम second और middle pulse पे जा रहे हैं. The second or the middle pulse, that is stomach 3. The stomach 3 is telling the condition, the chi of mouth. हमारे मुंह की ऊर्जा के बारे में बताती है. Okay. So mouth play a very important role. If we look at in this image, so the chi of mouth, the chi of mouth is also telling what is the condition of digestion. Means there are many conditions. How you speak, what is the condition of the mouth, many things. So for this, we are going to check pulse on the stomach 3. अब हम किसे चेक करेंगे? हम stomach 3 को चेक करेंगे. Stomach 3. From the mid-pupillary line, if we are going down, so this is the location of stomach 3 at the level of nose. हमारी नाक के लेवल पर यह हमारा stomach 3 है. This is also called great bone hole. हड्डी का एक बड़ा होल. Okay. This point is very much effective and it is telling what is the condition of chi of the mouth. So any problem in the mouth, we will be finding from here. Okay. What all the condition of the mouth we will be learning shortly. So we can palpate the pulse here from the mid-pupillary line. I'm dropping down at the level of nose. This is the location of stomach 3. Okay. Stomach 3 is also called, stomach 3 को हम एक चीज और भी कहते हैं. Stomach 3 here, we can know the stomach 1, stomach 2. There are many parts of the stomach meridian. Stomach 3 is here. So let's keep your two finger here on both the side and try to feel some pulse here. 20 seconds. Start. You can also use only single finger, like index finger or so. Like I can feel my clearly, like this side pulse is higher than this side. So you will feel some difference. One side pulse will be little different from the other side pulse. Okay, that is showing some changes, maybe some energy different on this side, some energy different on this side. Okay. Again, we will doing performing the same movement. Today we are going to do the same movement, and tomorrow we will introduce some more movement of this part. So today we will be doing the same movement. Now we will do only 3 times. So 3 times neck movement, 3 times Brahmari. Then we'll check the pulse again. Start. Inhale, going back. Exhale, coming forward. Inhale, going back. Exhale, coming forward. Inhale, going back. Complete the 3 round. Exhale, coming forward. Then relax. Now we'll do right and left. Right now, I'm not adding breathing with this. Just do the movement on the right and left side. 3 times on the right, 3 times on the left. Slowly, slowly, you will become a very wonderful channel. Now, rotational movement, half rotation. Because body is a medium. And we have to make this medium very open so that energy can flow, chi can flow without any obstruction. We can feel the chi very properly. Okay. So now we'll do Brahmari. The same condition, fold the tongue, but don't touch with the upper palate. If you're touching a little bit, there's no any issue. Just be very comfortable and be very flexible, but try not to touch with the upper palate. 3 times. Inhale. Relax. Again, bring your one finger or two finger. I'm comfortable with one finger, so I'm keeping on the stomach 3. Still, I can feel my pulse is relaxed, but still I can feel little speed pulse on the right side for me. It means some more energy on this side rather than this. Okay, we'll do the prediction later on, not right now. Okay, so the meaning is each and every pulse telling some meaning why the right pulse is faster than the left. Okay, so this was the second. Fine. So we have checked the pulse number 2. Let's move quickly on the pulse number 3. Do you feel any change in the any right or left faster than the other? Anyone? Or you feel equal? All of you? कुछ लगता है कि एक की ज्यादा एक की कम, या भी फील नहीं हो रही है? अगर फील भी नहीं हो रही है, ऐसा भी हो सकता है किसी को फील ना हो रही हो. ओके ओके okay, many person will not able to feel initially because I have seen even in the previous seminars of pulse diagnosis, many person take some time to feel the pulse. But it's okay, there is no problem. It's a question of training, it's a question of time. Okay, fine. Let's move to the pulse number 3. So I'm coming to this chart. So in the upper part, in the head region, now we have covered the upper pulse, middle pulse. Now we are going to the name is lower pulse. That is the pulse of the triple Barma 21, which is telling the condition of ear and eyes. So triple Barma 21, the telling condition of ear and eyes. Okay, this is really very wonderful pulse. So now I will tell you this. Let's see this. So now you want to find out what is the condition, what is the energy of the eyes. Eye play very important role because we are wasting too much energies from the eyes every day, every time. So what is the energy of eyes and what is the energy of the ear? So now we will try to find out the chi of ear and the chi of eyes. अब हम यहाँ की के बारे में पता करेंगे. There are many patients coming to you with the various problem the eyes, आंखों की प्रॉब्लम लेके आते हैं आपके पास पेशेंट. किसी को ग्लोकोमा है, किसी को कैटरैक्ट है, someone is having vision problem, someone is having various type of the like मायोपिया, हाइपरमेट्रोपिया, शॉर्ट साइटेडनेस, पास का नहीं दिखता, दूर का नहीं दिखता, आंखों का प्रेशर बढ़ गया है, बहुत सारी प्रॉब्लम हो सकती है. कान की प्रॉब्लम, टिनिटस, रिंगिंग साउंड इन द ईयर, डेफनेस, सुनाई ना देना, कानों में आवाज आना, कानों में इन्फेक्शन हो जाना. देयर माइट बी मेनी प्रॉब्लम ऑफ द ईयर एंड द आईज. सो नाउ वी विल ट्राई टू फाइंड आउट what is the condition of this third number pulse. So here the very our point is triple warmer 21. Okay, so this point is located in front of the ear. Now we can see how the triple warmer meridian is coming from here, then encircling the ear, then coming in the front side. हमारे कानों के आगे आता है. That is triple warmer 21. So how to look at the triple warmer 21 exactly? We can see if we open and close our mouth like this. We can open and close our mouth. We will feel one bony part here. Zygomatic. We can feel one bony part here. Okay. So we can feel the depression here. We will find one depression here. That is the triple warmer 21. Another technique I will tell you. We can feel this part of this flap of the ear. ये कान का ढक्कन. इसके ठीक बीच में है हमारा दूसरा point. The other point is here in front of this flap of the ear. The upper point is triple warmer 21 because we are having 3 point here. Triple warmer 21, SI 19 and gallbladder 2. Our focus is triple warmer 22, 21, which is located here, जो ऊपर है. Let's see here once again in this image. इस image में देखिए. So we can see this is the location of triple warmer 21. यहाँ पर हम देख सकते हैं triple warmer 21. Okay. Now we have to feel the pulse here. I got one patient of glaucoma. मेरे पास एक glaucoma का patient आया. ओके मैंने यहाँ पर पल्स चेक की और यहाँ पर चेक की. इधर की पल्स काफी थ्रॉबिंग थी. दिस राइट साइड पल्स वाज वेरी थ्रॉबिंग. ही वाज हैविंग मोर प्रेशर इन द राइट आईज. ओके राइट आईज वाज हैविंग मोर प्रेशर. I so I told you, if you keep your hand for 30 seconds, it is testing. Even 1 minute, it is testing. But if you are keeping your hand for more than 1 minute, it becomes treatment. Okay, so just I told, okay, lie down quietly, calmly, just touch this point very gently, very rhythm, in the very rhythm, and there is a fluid movement. We have to feel the movement of fluid that we will going to learn. So right now, just do the testing. Keep the finger here and see right side, left side pulse. And if you can do, then try to find out what is the difference on the right and left side. Wow, we can feel the clear pulse. How many person can feel the pulse here? Can you feel the pulse? This pulse is very important because this pulse is telling if the person is having some tinnitus, some ringing sound in the ear, some problem in the ear. If the pulse is throbbing, you can find out, oh, this is the excessive condition. So in this way, we can find out. Okay. So let's do quickly neck movement and Brahmari. Start. Inhale. Exhale. Very slowly, gently. Inhale. Exhale. Keep doing as per your own speed. We're doing on the right and left side. Okay. Now we'll do rotation. Relax. Again, feel the pulse here. Relax. So this was the quick discussion of three pulse Tomorrow will continue. Tomorrow I will also give you time if you have any questions, if you have any doubts. Okay, that will be discussed tomorrow because I have to cover some more portion. So tomorrow we'll be discussing. If you have any questions, you are welcome to ask tomorrow. Okay, fine. So clear, done. Now I will tell you one thing. When we are checking the pulse of someone, if we are not doing our own healing, like we are doing Brahmari, we are doing neck movement, we are performing lots of things. If we are not doing these all things, okay, then what will happen? Our energy might get affected badly by the patient energy. We are checking the pulse of the patient. If the patient is having liver problem, you might feel vibration in your liver. That's not good. Okay. The patient is having heart problem, you will start feeling some vibration in your heart. So we have to protect our body very nicely, very properly. So when we learn the pulse, the first step, making ourselves very fit, very intuitive, right? And a very good observer. Thank you so much everyone for joining this. We'll see you tomorrow. This video will be uploaded in the night, so you can see in the night or morning. Let's close the session. We'll see you tomorrow. Good night.